everybody, this video of mine is about hyperthyroidism. Whenever I discuss this topic, it gives me immense grief because my mother died of this condition. Anyways, I'll discuss this problem with you today. Hyperthyroidism is an overactive thyroid, which occurs when your thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate your body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Several treatments are available for hyperthyroidism. Doctors use anti-thyroid medications and radioactive iodine to slow the production of thyroid hormones. Sometimes hyperthyroidism treatment involves surgery to remove all or part of your thyroid gland. Although hyperthyroidism can be serious if you ignore it, most people respond well once hyperthyroidism is diagnosed and treated. Now I'll tell you the symptoms. Hyperthyroidism can mimic other health problems which can make it difficult for your doctor to diagnose. It can also cause a wide variety of signs and symptoms which include unintentional weight loss even when your appetite and food intake stay the same or increase, rapid heartbeat, that is tachycardia, commonly more than 100 beats a minute, irregular heartbeat, that is arrhythmia, pounding of your heart, which is known as palpitations, increased appetite, nervousness, anxiety and irritability, tremor, usually a fine trembling in your hands and fingers, sweating, changes in menstrual patterns, increased sensitivity to heat, changes in bowel patterns, especially more frequent bowel movements, an enlarged thyroid gland, that is known as goiter, which may appear as a swelling at the base of your neck, fatigue, muscle weakness, difficulty sleeping, skin thinning, fine brittle hair. Older adults are more likely to have either no signs or symptoms or subtle ones such as an increased heart rate, heat intolerance, and a tendency to become tired during ordinary activities. Sometimes an uncommon problem called grave ophthalmopathy may affect your eyes, especially if you smoke. This disorder makes your eyeballs protrude beyond their normal protective orbits when the tissues and muscles behind your eyes swell. Eye problems often improve without treatment. Signs and symptoms of grave ophthalmopathy include dry eyes, red or swollen eyes, excessive tearing or discomfort in one or both eyes, light sensitivity, blurry or double vision, inflammation or reduced eye movement, protruding eyeballs. If you experience unexplained weight loss, a rapid heartbeat, unusual sweating, swelling at the base of your neck or other signs and symptoms associated with hyperthyroidism, you should see your doctor. It's important to completely describe the changes you have observed because many signs and symptoms of hyperthyroidism may be associated with a number of other conditions. If you have been treated for hyperthyroidism or you currently are being treated, see your doctor regularly as advised so that he or she can monitor your condition. Now let me tell you the causes. Hyperthyroidism can be caused by a number of conditions including Graves' disease, Plummer's disease and thyroiditis. Your thyroid is a small butterfly-shaped gland at the base of your neck, just below your Adam's apple. The thyroid gland has an enormous impact on your health. Every aspect of your metabolism is regulated by thyroid hormones. Your thyroid gland produces two main hormones, thyroxine, that is T4, and triiodothyronine, that is T3, that influence every cell in your body. They maintain the rate at which your body uses fat and carbohydrates, help control your body temperature, influence your heart rate, and help regulate the production of protein. Your thyroid also produces a hormone that helps regulate the amount of calcium in your blood. And this hormone is known as calcitonin. Now I'll tell you the reason why there is too much thyroxine. Normally your thyroid releases the right amount of hormone, but sometimes it produces too much T4. This may occur for a number of reasons, including Graves' disease. This is an autoimmune disorder in which antibodies produced by your immune system stimulate your thyroid to produce too much T4. It is the most common cause of hyperthyroidism. Hyperfunctioning thyroid nodules, that is toxic adenoma, toxic multinodular goiter or Plummer disease. This form of hyperthyroidism occurs when one or more adenomas of your thyroid produce too much T4. An adenoma is a part of the gland that has walled itself from the rest of the gland, forming non-cancerous, which are benign lumps that may cause an enlargement of the thyroid. Thyroiditis. Sometimes your thyroid gland can become inflamed after pregnancy due to an autoimmune condition or for unknown reasons. The inflammation can cause excess thyroid hormone stored in the gland to leak into your bloodstream. Some types of thyroiditis may cause pain, while others are painless. Now I'll tell you the risk factors for hyperthyroidism. These include a family history, particularly of Graves' disease, female sex, a personal history of certain chronic illnesses such as type 1 diabetes, pernicious anemia, and primary adrenal insufficiency. Now coming to the complication, hyperthyroidism can lead to a number of complications such as heart problems. Some of the most serious complications of hyperthyroidism involve the heart. These include a rapid heart rate, a heart rhythm disorder called atrial fibrillation that increases your risk of stroke, and congestive heart failure, which is a condition in which your heart cannot circulate enough blood to meet your body's needs. Second is brittle bones. Untreated hyperthyroidism can also lead to weak, brittle bones that is known as osteoporosis. The strength of your bones depends in part on the amount of calcium and other minerals they contain. Too much thyroid hormone interferes with your body's ability to incorporate calcium into your bones. Eye problems. People with Graves' ophthalmopathy develop eye problems including bulging, red or swollen eyes, sensitivity to light, and blurring or double vision. Untreated severe eye problems can lead to vision loss. Red swollen skin. In rare cases, people with Graves' disease develop Graves' dermopathy. This affects the skin, causing redness and swelling, often on the shins and feet. Thyrotoxic crisis. Hypothyroidism also places you at risk of thyrotoxic crisis, a sudden intensification of your symptoms leading to a fever, rapid pulse, and even delirium. If this occurs, seek immediate medical care. Now coming to the diagnosis. Hyperthyroidism is diagnosed using medical history and physical exam. During the exam, your doctor may try to detect a slight tremor in your fingers when they are extended, overactive reflexes, eye changes, and warm, moist skin. Your doctor will also examine your thyroid gland as you swallow to see if it is enlarged, bumpy, or tender, and check your pulse to see if it is rapid or irregular. Blood tests. Blood tests that measure thyroxine and thyroid stimulating hormone, that is TSH, can confirm the diagnosis. High levels of thyroxine and low or non-existent amount of TSH indicate an overactive thyroid. The amount of TSH is important because it is the hormone that signals your thyroid gland to produce more thyroxine. These tests are particularly necessary for older adults who may not have classic symptoms of hyperthyroidism. Thyroid blood tests may give false results if you are taking biotin, a vitamin B vitamin supplement that may also be found in the multivitamins. Let your doctor know if you are using biotin or a multivitamin with biotin. To ensure an accurate test, stop taking biotin at least 12 hours before blood is taken. If blood tests indicate hyperthyroidism, your doctor may recommend one of the following tests to help determine why your thyroid is overactive. Radioiodine uptake test. For this test, you take a small oral dose of radioactive iodine to see how much will collect in your thyroid gland. You will be checked after 4, 6 or 24 hours and sometime after all 3 time period to see how much iodine your thyroid has absorbed. A high uptake of radioiodines indicates your thyroid gland is producing too much thyroxine. The most likely cause is either Graves' disease or hyperfunctioning thyroid nodules. If you have hyperthyroidism and your radioiodine uptake is low, this indicates that the thyroxine stored in the gland is leaking into the bloodstream, which may mean you have thyroiditis. Thyroid scan. During this test, you will have a radioactive isotope injected into the vein on the inside of your elbow or sometimes into a vein in your hand. You then lie on a table with your head stretched backwards while a special camera produces an image of your thyroid gland on a computer screen. This test shows how iodine collects in your thyroid. Thyroid ultrasound. This test uses high-frequency sound waves to produce images of the thyroid. Ultrasound may be better at detecting thyroid nodules than other tests, and there is no exposure to any radiation. Now let me tell you the treatment. Several treatments for hyperthyroidism exist. The best approach for you depends on your age, physical condition, the underlying cause of the hyperthyroidism, personal preference, and the severity of your disorder. Possible treatment includes radioactive iodine. Taken by mouth, radioactive iodine is absorbed by your thyroid gland where it causes the gland to shrink. Symptoms usually subside within several months. Excessive radioactive iodine disappears from the body in weeks to months. This treatment may cause thyroid activity to slow enough to be considered underactive hypothyroidism, and you may eventually need to take medication every day to replace thyroxine. Anti-thyroid medications. These medications gradually reduce symptoms of hyperthyroidism by preventing your thyroid gland from producing excess amounts of hormones. They include methimazole, that also comes with the name of tapazole, and propylthiouracil. Symptoms usually begin to improve within several weeks to months, but treatment with anti-thyroid medication typically continues at least a year and often longer. For some people, this clears up the problem permanently, but other people may experience a relapse. Both drugs can cause serious liver damage, sometimes leading to death. Because propylthiouracil has caused far more cases of liver damage, it generally should be used only when you cannot tolerate methimazole. A small number of people who are allergic to these drugs may develop skin rashes, hives, fever, or joint pain. They also can make you more susceptible to infections. Another category of drugs is beta blockers. Although these drugs are usually used to treat high blood pressure and do not affect thyroid levels, they can ease symptoms of hypothyroidism such as tremor, rapid heart rate, and palpitations. For that reason, your doctor may prescribe them to help you feel better until your thyroid levels are closer to normal. These medications generally are not recommended for people who have asthma, and side effects may include fatigue and sexual dysfunction. Surgery, that is known as thyroidectomy. If you are pregnant or you otherwise cannot tolerate anti-thyroid drugs and don't want to or cannot have radioactive iodine therapy, you may be a candidate for thyroid surgery, although this is an option in only a few cases. In a thyroidectomy, your doctor removes most of your thyroid gland. Risks of this surgery include damage to your vocal cords and parathyroid glands, which are four tiny glands situated on the back of your thyroid gland that help control the level of calcium in your blood. In addition, you will need lifelong treatment with levothyroxine to supply your body with normal amounts of thyroid hormone. If your parathyroid glands also are removed, you will need medication to keep your blood calcium levels normal. Now I'll tell you the treatment of Graves' ophthalmopathy. If Graves' disease affects your eyes, you can manage mild signs and symptoms by using artificial tears and lubricating gels and by avoiding wind and bright lights. If your symptoms are more severe, your doctor may recommend treatment with corticosteroids such as prednisolone to reduce swelling behind your eyeballs. The drugs rituximab and teprotumumab are being used to treat Graves' ophthalmopathy, even though there is not a lot of definitive evidence yet to prove that they are effective. Teprotumumab received fast-track approval from FDA based on one small study. More study of both drugs as a treatment for Graves' ophthalmopathy is needed. In some cases, a surgical procedure may be an option. This surgical procedure can be orbital decompression surgery. In this surgery, your doctor removes the bone between your eye socket and your sinuses, the air spaces next to the eye socket. When the procedure is successful, it improves vision and provides room for your eyes to return to their normal position. But there is a risk of complication, including double vision that persists or appears after surgery. Eye muscle surgery. Sometimes scar tissue from Graves' ophthalmopathy can cause one or more eye muscles to be too short. This pulls your eyes out of alignment, leading to double vision. Eye muscle surgery may help correct double vision by cutting the affected muscle from the eyeball and reattaching it further back. Now I'll tell you some lifestyle and home remedies. Once you begin treatment, the symptoms of hypothyroidism should subside and you should start feeling much better. However, your doctor may recommend that you watch out for iodine in your diet because it can cause hypothyroidism or make it worse. Kelp, dulce, and other types of seaweed contain a lot of iodine. Cough syrup and multivitamins also may contain iodine. For grave disease, if you have grave ophthalmopathy or dermopathy, here are some other suggestions for your eyes or skin. Do not smoke. Smoking has been linked to the development of grave ophthalmopathy and can make the condition worse after treatment. Keep your eyes lubricated. Eye drops may help relieve dryness and scratchiness at any time of the day. If your eyes do not completely close, you can tape your eyelids shut or use a lubricating gel at bedtime to keep the cornea from drying out. A cool compress can also provide relieving moisture. Protect your eyes. Wear sunglasses to help protect your eyes from the sun and wind. Keep your head up. Raising the head of your bed may reduce swelling and relieve pressure on your eyes. Try over-the-counter creams for swollen skin. Over-the-counter creams containing hydrocortisone, that is, it comes with the name of cortisone 10. Others may help relieve red swollen skin on your shins and feet. For help finding these creams, you should talk to your pharmacist. I hope you have listened carefully to all my video, and this video of mine is hyperthyroidism, and if you are suffering from hyperthyroidism or any other problem, please comment in the comment section of this video. Until now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide a little bit benefit to you, even if it is 5%, 10%, please like this video and share this video with your family and friends. And if possible, please share my videos through social media on Facebook, WhatsApp, and Twitter, and other social media platforms. Thanks for watching my video. See you in next video. Bye.